Hi everybody, today my topic of video is angioedema. This is a swelling underneath the skin. It's usually a reaction to a trigger such as a medicine or something you are allergic to. It is not normally serious, but it can be a recurring problem for some people and can very occasionally be life-threatening if it affects breathing. Treatment can usually help keep the swelling under control. Now let me tell you some of the symptoms of angioedema. The main symptoms of angioedema is a swelling that develops below the skin surface. Swelling caused by angioedema can develop suddenly or come on gradually over a few hours. It normally lasts a few days. The swelling most often affects the hands, feet, area around the eyes, lips and tongues, genitals. In severe cases, the inside of the throat or bowel can be affected. That can lead to medical emergency. If it is affecting your throat, then there could be a difficulty in breathing, or if it is affecting your bowel, then there may be a severe abdominal pain. The next come the symptoms of rash. Often the swelling occurs with a raised itchy rash called urticaria, also known as hives. The rash will eventually settle in a few days. Otherwise, the skin over the swelling may feel tight and painful but looks normal. Here are some other symptoms which are less common, but I must tell you. These are the red irritated eyes, that is known as conjunctivitis, and you may have a sickness feeling, and there could be a episode of diarrhea, and you may suffer from fainting and dizziness. You must see your doctor if you have episodes of swelling that affect your skin or lips and you are not certain of the cause. You may need to have some tests to determine the cause, and if you are in the UK, you can dial 999 and that will be for ambulance. And also, if there is you must call this emergency help if there is a sudden or worsening breathing problems, or you are feeling dizziness, or passes out or collapse. These are the signs of serious allergic reaction, which is known as anaphylaxis in our medical terms. If you are the person who is ill, have been prescribed an adrenaline auto-injector, then you should use it even before waiting for the ambulance to arrive. Now let me tell you some of the causes of angioedema. This can have several different causes, but in many cases the exact cause is unknown. Now let me tell you some of the main causes. First of all, it is due to allergies. This is often the result of an allergic reaction. This is where the body mistakes a harmless substance such as certain food for something dangerous. It releases chemicals into the body to attack the substance, which causes the skin to swell. Angioedema can be triggered by an allergic reaction to certain types of food such as nuts, shellfish, milk and eggs. It can also be triggered by some types of medicine, for example antibiotics, aspirin, and other non-steroidal anti-inflammatory drugs such as ibuprofen. Also, insects bites and stings, particularly wasp and bee stings, can result in angioedema. There is another cause, which is a latex. This is a type of rubber used to make medical gloves, balloons and condoms. Angioedema caused by allergy is known as allergic angioedema. Then the next cause is medicines. Some medicine can cause angioedema even if you are not allergic to the medicine, which means that first I told you the allergic causes of angioedema, and there are medicines like ibuprofen or aspirin that can cause allergy, but medicine, this is the second cause, which is a medicine. They can cause angioedema even without allergy to the medicine. So what happens is that the swellings may occur soon after you start taking a new medicine, or possibly months or even years after taking the medicines. Here I'll give you some of the examples of medicine which can cause this angioedema. First of all, there is a group of drugs known as angiotensin converting enzyme inhibitors, which are used in the treatment of high blood pressure, such as enalapril, lisinopril, perindopril, and ramipril. And second is ibuprofen and other types of non-steroidal anti-inflammatory drugs, which are usually used as painkillers. Then there is the third group of drugs that is known as angiotensin 2 receptor blockers. These are also used for high blood pressure. Examples are irbesartan, losartan, olmesartan, and valsartan. All of these medicines can cause angioedema. And this angioedema due to medicines is known as drug-induced angioedema. Okay, the third and very important cause is genetics. Rarely angioedema occurs because of a genetic fault that you inherit from your parents. The fault affects the gene responsible for the production of a substance called C1 esterase inhibitor. If you don't have enough of this, the immune system can occasionally misfire and cause angioedema. The swelling may happen randomly, or it may be triggered by an injury or infection, surgery and dental treatment, stress, pregnancy, certain medicines such as the contraceptive pills. Which means that if you have hereditary angioedema, these triggering factors which I just told you can cause angioedema. How often the swelling occurs can vary. Some people experience it every week, while in others it may occur less than once a year. Angioedema caused by genetic fault is known as hereditary angioedema. If you have it, you have a 1 in 2 chance of passing it on your children because it's an autosomal dominant condition. Fourth cause or type of angioedema is idiopathic, which means there is no known cause. In many cases, it's not clear what causes angioedema. One theory is that an unknown problem with the immune system might cause it to occasionally misfire. There are certain triggers which may lead to swelling, such as anxiety or stress, minor infection, hot or cold temperature, strenuous exercise. In very rare cases, the swelling may be associated with other medical conditions such as lupus or lymphoma, which is a cancer of the lymphatic system. This angioedema without a clear cause is known as idiopathic angioedema. Coming to the diagnosis of angioedema, if you have experienced angioedema for the first time, your doctor will try to work out what may have caused it. There are several different causes of angioedema. It's important to know what's causing your problem, as this affects the treatment you will need. There is no single test to determine the cause of angioedema. Some of the checks and tests you may have are described in this video. First of all, when the patients come to us, we take a proper history and we also do a medical examination of the patient. So what happens that we need to find out the cause, which is the reason which is causing angioedema. We ask questions in your medical history and question about your symptom. For example, it's likely to have been caused by an allergy if you are exposed to something that can trigger allergic reaction soon before it started, or if you have also developed a raised itchy rash. It may have been triggered by a medicine if you are currently taking a medicine that is associated with angioedema, such as ACE inhibitors, which I just told you. It's possible your symptoms are a result of an inherited genetic fault if you have a family history of angioedema. So also we ask for the food history. As I told you previously that there are certain allergens which are due to food. So we actually do all the medical examination, and after history taking, that we come to the test for this angioedema. If we think that your symptom may have caused by an allergy, then we may advise to the test. We can refer you to a specialist allergy or immunology clinic for further testing. These tests may include a skin prick test, in which your skin is pricked with a tiny amount of the suspected allergen to see whether there is a reaction. Also, there is another blood test for the allergy. In this, a sample of your blood is tested to determine whether your immune system reacts to a suspected allergen. These tests can help determine what you are allergic to. Also, we may advise some other blood test if we think that your symptom may be caused by genetic fault you have inherited from your parents. Then you may be referred for a blood test. These tests check the level of a substance called C1 esterase inhibitor in your blood. This substance is important in regulating the immune system. A very low level of C1 esterase inhibitor would suggest you have an inherited problem affecting how much of this substance your body is able to produce. Now let me tell you the treatment option available for angioedema. The treatment for angioedema depends upon what's causing it. As I told you, there are several different types of edema, and each of which has a different cause. Angioedema can usually be treated at home, although severe cases may need to be treated in hospital. Now I'll come to the individual section of treatment. First of all, let me tell you about allergic and idiopathic angioedema. Allergic angioedema and idiopathic angioedema are usually treated in a similar way, and that is by avoiding triggers. If you avoid particular substances or activities that trigger your symptom, may help reduce your chances of experiencing these swellings due to angioedema. For example, if you are allergic to a certain types of food, it can help to check the ingredients in your food you buy and be careful when you are eating out. Also, we give some drugs which are known as antihistamine and steroids. Initially, we prescribe this non-sedating antihistamine. These work by blocking the effects of histamine, which is one of the chemicals responsible for all allergic symptoms. Swelling. Some types can be bought in pharmacies and supermarkets without a prescription. Some antihistamine can make you feel drowsy. If there is if you are not responding with non-sedative medicine, then we may prescribe some medicine, antihistamine, which can lead to drowsiness. So if you are taking those kind of antihistamine, you should avoid driving, drinking alcohol, or operating dangerous machinery if you are experiencing this. If you are taking these medicine, you should avoid these things which I told you. Driving, drinking alcohol, or operating machinery. If your symptoms of swelling occur during the day, it's best to take non-drowsy medicines such as cetirizine and loratadine. There are some side effects of antihistamine such as headache and dry mouth and a dry nose. If the swelling of your angioedema is severe, your doctor may prescribe a short course of steroid medicine. This is a powerful medicine that can be used for short periods because it can have troublesome side effects. So we normally, when we prescribe steroids, we prescribe it for short-term periods because for the longer term they may have some serious side effects. Then comes adrenaline auto-injectors. If you have a particular serious allergy, you may be given adrenaline auto-injector to use if you experience a severe allergic reaction, that is known as anaphylaxis. There are several types of auto-injector which are used in slightly different ways. Now coming to the drug-induced angioedema. If a certain medicine you are taking is thought to be responsible for your angioedema, your doctor will usually advise stopping it, and they can prescribe a different medicine for you to take instead. This is usually all that needs to be done. You should tell your doctor if your symptoms continue or come back after switching medicine. Now let me tell you the treatment of hereditary angioedema. This cannot be cured, but medicine can help prevent and treat the swelling. First of all, how to prevent swelling? Medicines such as danazole and oxandrolone can help reduce the chances of swelling occurring if you have hereditary angioedema. These medicine boost the level of C1 esterase inhibitor in your blood. Low level of this substance are what causes the swelling. Here are some side effects which I must tell you if you use danazole or oxandrolone. There could be a weight gain in women, excessive body or facial hair growth, deepening of the voice, irregular period or absent periods, depression, high blood pressure, liver problem. There is another medicine, tranexamic acid, that can also be used sometimes as an alternative, particularly in children and women. This medicine which has very few side effects, but it may not be so much potent medicine to prevent you from this swelling due to angioedema. This medicine has less side effects, but it's not a potent treatment, but sometimes we use it. Okay, now let me come to how to treat swelling. The two main treatments used to treat swelling caused by hereditary angioedema are first of all, there is a drug known as incatibant. This is a medicine given by injection that blocks the effects of some of the chemical responsible for the swelling. Then we can also give a replacement of C1 esterase inhibitor. This treatment given by injection boosts the level of C1 esterase inhibitor in your blood, because in artery angioedema, as I just told you, there is a deficiency of C1 esterase inhibitor. So we can directly give injections of this substance. Occasionally, what happens is C1 esterase inhibitor replacement may also be used shortly before surgery or dental treatment, as it can reduce the risk of these triggering swellings. Also, you may be given a supply of medicine to keep at home, or you will be taught how to give the injections yourself. I hope you like this video of mine. If you have any other problem regarding your health, or if you have not even your health, if you have any other issue, you can discuss with me by posting comments on the comment section of this YouTube video. And if you want that I should make a video on some other illness which your family or friends may be suffering, then you should tell me and I'll try to make a video. And if you have not yet subscribed to the channel, please subscribe it as soon as possible, and click on the bell icons and select the option for all, so that all upcoming videos will be delivered to your inbox straight away. Also, if you think that there is even a little bit benefit of this video for you, then please like this video and share this video with your family and friends. Thank you very much for watching my video. See you soon in next video. Bye.